Welcome back to Morning Barbados. We are in the segment where usually you'll hear the little baby crying in the background. It's time for Doctor on the Line, and we welcome with our usual ebullient nature, Dr. Adrian Lord. It's always a pleasure to have you, Doc.
Good morning, Colin. I heard you were under the weather on Monday. You see, you're back yesterday and you're here today.
Yes, I am. Yes, I am. You know, I tried.
Had a hard weekend, eh?
You know how it is. It gets pretty hard when you have to run behind someone who is like
under 4 foot,
10% of your age.
You got to get fit.
Yeah, yeah, I'm working
fit
on
for
that.
cup over.
Well, of course I have to get fit for crop over. I have to get fit, though. Tell me, any secret, any little, anything?
You started.
Oh, run behind him. All right.
Then it was no use yesterday.
All right.
Monday.
We're going to start right off with a question that we had from one of our viewers. Okay,
the viewer wanted to know about shingles.
Shingles,
not on the roof, I take it.
Oh,
I don't
okay,
have the email with me, but...
Oh, okay.
Do you have those skills too, Doc? You can actually do roofs too?
No, I'm not good at that. I'm just good at this. Shingles, yeah, that is a not an uncommon condition. It's actually caused by the same virus that causes chickenpox. So usually the person may have had chickenpox before, and then they get a reinfection. And you get these blisters which come on the skin, usually in one segment. It's caused by the herpes zoster virus. And when people hear herpes, they say, oh, it's bad. And, no, the herpes that you tend to worry about is the herpes simplex. This is another of the family of herpes viruses. And it lives in the nerve root, and it can cause severe pain. If picked up early, there are antiviral tablets that can be used to be taken for a week or a little more than that. Creams and painkillers, anti-inflammatory and other painkillers can be used to help with the pain. But the thing about it is that it can last for a long time. 3 to 6 months of pain in that particular segment. It's usually on one side of the body. It doesn't cross the other side. For instance, if it's by the rib, it doesn't cross the midline, or on the forehead, or the back, or the leg. And most times people think it's just a rash or allergy, but it's usually limited to one area.
So it lasts about 6 months if you pick it up early?
If
or
you
is
pick
that
it early,
just general?
yeah, generally it can last as long as that.
Okay.
And usually people who are under stress or debilitated or may have some other chronic illness may have it, but you might just... Before, you only used to hear about shingles in the elderly, but you can have it in the younger age group. Okay,
hopefully that's been helpful to you. And your emails are always welcome. ccrawford@cbc.bb. And we are also welcoming your calls, 228-5562 or 63. I believe Bernice is on hold. Good morning, Bernice. Thank you for your patience.
Good morning.
Good morning. Vernice, go ahead.
Good morning, Dr. Lord.
Good morning.
I have some cramp in my fingers every night, a numbness. I was wondering if that is a sign of heart attack.
Unlikely. Heart attack, and actually it's interesting because I was thinking about talking about heart attack this morning. But heart attack normally would give a chest pain, severe chest pain with tightness. Sometimes there may be difficulty in breathing. It can cause palpitations, dizziness, sweating profusely, and it may radiate to the neck or one or other arm. You mentioned about cramps in the hands, and I should have asked you if you meant the arm, hand, or wherever. And I interpreted it as the hand. That could be a localized problem due to muscular problem. It could be an overuse problem. It could be carpal tunnel, but it's unlikely to be a heart attack. Having said that, there are several people who have heart attacks that are silent. Especially diabetics tend to have silent heart attacks, so you don't get any of those symptoms at all.
Okay.
Perhaps to follow on from your response, we could go into a little bit more detail as to what to look for if you think you are having a silent heart attack, because diabetics tend to handle things slightly differently.
And women tend to be more misdiagnosed in heart conditions than men. And maybe because most doctors are men. I don't know.
I'm not going there with you, Doc.
Actually, most doctors now are women. Most of our graduates, female graduates at UE. But the things that you do is get to an emergency.
Before you get into the actual things to do, let's take another caller, Doc. Julius is on the line. Good morning.
Good morning.
Morning. Morning.
I would like the doc to explain what is sciatic nerve stress and how it can be treated.
Okay.
What is sciatic nerve?
Stress.
Stress.
Sciatic nerve stress.
Stress.
And the treatment.
Well, I know what is sciatic nerve inflammation or sciatica. Sciatic nerve is a nerve which comes from the back of the lower back that goes right down the back of the thigh and into the leg. It can be caused by arthritis in the lower back. If you have a prolapsed disc, that's a bulging disc between the vertebrae. If you have spasm of the muscles due to back injury, where the nerve passes through this area and gets squeezed, or as Beatles would say, pinched, and you get radiated pain, numbness, and tingling going down the leg. The treatment of it is to treat the cause, whatever that cause is. And I mentioned some of the possible causes, there are others. And it should be rest, physiotherapy, medication, and if it is a prolapsed disc, a disc from the vertebra that is pressing on a nerve, then as a last resort, surgery may be considered.
All right, so let's get back to your signs of a silent heart attack.
Well, there are no signs.
Signs, yeah.
There are no signs. Most times we discover those when we do the electrocardiogram and realize that this person has had a heart attack, or when you do blood tests for the cardiac enzymes. These are the enzymes of the muscles of the heart which are elevated at the time of a heart attack. And several times, or maybe an electrocardiogram for some other reason later, and say, well, this person would have had a heart attack at some time. You know, Beijing, so that was just gas.
Okay.
Should you be
worried?
Yeah.
As far as being worried, as far as preventing, as far as diabetics are concerned, and the general population, is to maintain a healthy lifestyle. Exercise, eat properly, watch your cholesterol intake, to prevent these things wherever possible. And if you have high cholesterol, you need to get that down, because that is a risk factor. Diabetes, hypertension, keep them well controlled all the time.
We have
Okay, one of the things I was just going to say is, one of the things I've had to deal with is a situation of acne, and we actually have a viewer who wants to know what causes it. I'm sure there are many reasons, but what can you say? And this is, we're aware you're not a dermatologist, but do your best to explain.
Yes, acne is seen commonly in young adolescents as the hormones develop at that time, and they cause a lot of pimples on the face and comedones and other inflammatory reactions to the skin. Or you can get adult acne, sometimes caused by stress, sometimes caused by certain medications. Wear my hat as a sports medicine doctor. If we see acne in an athlete, we suspect the person may be using anabolic steroids. So I'm not saying that if you see acne in your friend that, or Cassandra.
I am not using any anabolic steroids.
But no, so those are some of the causes. It's due to this increased sebaceous glands in the face, and the thing about it is not to squeeze them. You need to see a dermatologist or a doctor. There's several preparations and soaps and creams and lotions that can be used. Yeah,
and that's like saying to
people
they leave scarring, and you can be treated just by putting persons on, like females can go on a special contraceptive pill that can help with acne. There are other creams and lotions and so on that can be used.
I think acne is one of those questions like the common cold, if we feel like we'll never get rid of it. However, we hope that Mary, who is holding, doesn't have any of those afflictions. Good morning. Thanks for holding. Welcome to the program.
Good morning. Good morning.
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 I don't drink soft drink, what we call carbonated drinks, but I am a Morbi fanatic, and I drink a lot of Morbi, probably 2-3 pints a day.
Wow.
I'm told that somebody tell me you shouldn't drink so much Morbi that it thins your blood. Is this true?
I am not aware of that. I've heard that the Morbi bark may have some of those properties, and something that maybe the Chronic Disease Research Center here in Barbados at the University of West Indies can look into. But I haven't heard about that scientifically, but I've heard persons mention of it. But why not drink 2 or 3, what you said, liters of water? That would be better, because if you're using Morbi or Morbi syrup, it can lead to obesity if you have too much sugar in the Morbi. So
She may be making it the old-fashioned way.
Maybe she's doing it.
Boiling the bark and.
That's how I grew up, and my great aunt said it was a cooling for you. So you drink the Morbi because it cools down your system. I wish I had some now on these hot days, you know.
Morbi with aniseed.
And speaking of hot days, perhaps we can get into a little bit of how we navigate carnival season without dehydration.
Carnival or
crop over. Sorry, this is the season.
It's still a carnival. It's just that we call it crop over.
It's more than a carnival.
It's the sweetest summer festival.
We will not quibble over that. We will go to the phone line line instead and hear
good morning
from
to Greg.
Good morning.
Hey, good
Morning.
morning to you.
Good morning, Greg.
Good morning. I would like to ask the doctor, if I find out I get itching on both my feet, what causes that?
That is difficult to say what may be causing it. It could be due to increased sweating in the area, maybe the socks are not changing regularly, and I'm assuming there again, Colin, feet is below the ankle.
I was thinking the same thing when you was calling. I was like,
That's the foot.
you should ask him exactly where.
If it's of the lower extremities, he should rule out diabetes as a possible cause as well. But it could be a rash.
Rule it out?
Yeah, you should make sure that he doesn't have high blood sugar.
Okay.
Yeah, get checked for diabetes as a possible cause. But it could be a rash, it could be irritation, it could be a contact dermatitis with his socks or shoes or whatever. It could be athlete's feet. Yeah, so many possible things. See your doctor, Greg.
All right.
Well, it's time for us to take a very short commercial break, and when we come back, we continue with your calls, comments, and queries with our doctor on the line, Adrian Lord. We'll be right back.